So a little bit about myself. My name is Ashley Calderone. I am a nurse. My background is in maternal child healthcare. I have worked in a variety of settings in pediatrics, neonatal intensive care unit, postpartum, as well as a lactation consultant. And I have a degree as a doctor of nursing practice. I currently work for the National Healthy Start Association on a project called AIM-CCI as the Clinical Implementation Manager. I also have served for the last 5.5 years on the board of the Martin County Healthy Start, where I currently hold the seat of vice chair. So when we're looking at maternal child healthcare, we know that about 800 women nationally die as a result of a pregnancy complication. We know that about a third of those deaths occur during delivery. We also know that about a third of those deaths happen during pregnancy, and about a third of those deaths happen in the first year postpartum. So while there are absolutely necessary precautions and interventions taking place in hospital settings, we know there's a huge space in the community where we can prevent some of these deaths that are happening to women. We also know that of those 800 deaths that are occurring, about 2 to 3 times more likely is a Black woman to die as a result of a pregnancy complication compared to white women. And that's a problem that we see across the board on a national level as well as at state levels. National Healthy Start was awarded a grant from HRSA in 2019 called AIM-CCI. It's the Alliance for Innovation in Maternal Healthcare Community Care Initiative. That is where we have been tasked with creating non-hospital focused, community-centric maternal safety bundles. These pilot sites are testing and implementing newly developed maternal safety bundles in each of their communities. The National Healthy Start is based in equity. The whole intention is to uncover and address systematic problems, look at the root causes, and help to prevent deaths that are happening in community. What we have learned from centering the voice of the community via focus groups and from including our pilot sites in the development of these maternal safety bundles along with subject matter experts is that women, and particularly women of color, Black women, are not feeling heard. They are not feeling respected, and they are fearful to speak up. And we are working to uncover and address racism as a root cause of these preventable deaths. As a nurse, I have worked in hospital facilities and outpatient facilities across the state for 15 years, and I've seen firsthand the discrimination that takes place. Oftentimes it's not spoken, it's not intentional, but there is implicit bias that occurs. I remember as a new nurse going into a high-risk facility, it was a trauma center, and it was very well known that women who delivered in this hospital, if they had insurance, they went to the wing that was newer, it was closer to the nurse's station, and it was more appealing to the eye. And the women who were uninsured were automatically taken to the other wing where they were away from the nurse's station. These women oftentimes were the ones who needed the most care, who had comorbidities, who were at higher risk for having a complication, yet they were taken to another wing. And I just remember being completely shocked as a entry-level nurse and seeing this firsthand. That's just one example of many. And how that was accepted as a cultural norm within that facility, I found to be disturbing. Throughout my career, I have witnessed women being spoken to by healthcare professionals in ways that were unacceptable. And I'm tired of being mad about it, and yet I'm only one person. So to be a part of AIM-CCI National Healthy Start and to really work to address these root causes is my passion. As the Clinical Implementation Manager for AIM-CCI at the National Healthy Start Association, I work directly with our 6 pilot sites to center the voice of the community to create these maternal safety bundles, which are small sets of evidence-based interventions that we believe, when implemented in a systematic fashion, will reduce complications and help women to have healthier pregnancies and deliveries despite their race, despite their zip code, and that all women will have the same opportunity and all families will have the same opportunity to thrive.